In terms of why a student should study at Newman University, the first sort of reason for me is the fact that we've got a fantastic opportunity to provide a student-focused approach whereby the student is the centre of the learning and teaching at all times. So the fact that we're able to have small group sizes is key to that, and as the tutors will be able to on the nursing programme and within mental health nursing, we'll be able to provide that one-to-one support. So thinking about why a student should choose Newman University, one of the really exciting things for me is the fact that we've got access to some really state-of-the-art simulation facilities. When thinking about the journey of a mental health student nurse on programme, those simulation facilities could be used for lots of different things. In terms of an example, so we have a immersive suite here on site, and within that immersive suite we could recreate somebody's living room, we could recreate what that environment could look like, and then we could then look at the students doing mental health assessments with a standardised patient or a simulated patient within that environment to really get an idea of what that might actually feel like. A reason why students should choose to study here at Newman University would be the fact that mental health is a core part of the programme. So not only will you be learning about mental health, the rest of the cohort, whether they are adult nursing students or whether they are physiotherapy students, will also be learning about mental health. Another key aspect is the fact that we really want the professional identity and the role of the mental health student nurse or the role of the mental health nurse to be really clear within that programme. Therefore, we are looking at key core mental health nursing modules whereby we'll be able to look at those key core capabilities that a mental health nurse will need to care for a diverse population. In terms of what a student's day-to-day life on the mental health nursing course would look like, that would depend on whether they were in theory or out in clinical practice. So if it was, for example, that they were in theory, they would be attending sessions in terms of teaching sessions, whether that's online or that could be face-to-face as well, coming into the classroom. A big part of our theory and programme will be spending time within the simulation area and the skills labs, learning those sort of core key mental health nursing skills that are needed to practice as a mental health nurse. A typical day could look like you attending at 7 o'clock in the morning. You would receive a handover from the night shift to understand what had been happening overnight with a particular patient group in that unit, and then you would then be supervised by a practice assessor or a practice supervisor in that clinical environment. In terms of supporting people with mental health problems or mental health issues in clinical practice on a practice placement, that could range between supporting with medication, it could be talking to somebody and giving them the opportunity to talk to you about sort of their needs, how they're feeling at that moment in time. So in terms of key skills, listening skills are key. We have quite a sort of diverse range of courses that are already being delivered here at Newman University, and we've got a real opportunity to provide that interprofessional learning sort of environment for mental health student nurses.